So there's going to be a very quick video on something that has been bothering me for many a year. It's bad knees. Now, when you look at these, I know the first thing people will say, what a magnificent set of pins. Yeah, they may look alright, but I tell you something, they don't feel alright. And for a lot of years I've had knee pain in both knees. A few years ago I had my right knee x-rayed and scanned, and I was told I needed replacing. So I was given a couple of months before I had to go and see him again and organise the time to get the replacement done. In that time I lost about 1.5 stone of weight. I changed the way I drove. Instead of having a bent knee, I now drive with almost a straight knee, and the benefit was absolutely fantastic. I also started wearing these knee supports, and I think a combination of all them three things, when I went back and seen him, I told him that basically my knee felt okay. Okay then, I think we'll leave it for a while. Maybe he's another couple of years left before we need to replace that. That was 3 years ago, and my right knee is still going strong to this day. I'm having a lot of problems now with my left knee. Now, one thing I got told many years ago, again when I was in hospital, was that your kneecap should go down and be level with your shin bone. And both of my knees don't do that. That one goes out that way, and that one goes out that way. That's one of the reasons you're going to get knee pain. Obviously, the other reason is normal wear and tear, because I've had both knees x-rayed there now. Both knees are covered with arthritis. So every now and again I would maybe just get a bit of a flare up on one of my knees, and I would take the go-to naproxen tablets, and after a few days it would settle down and I would be fine. The other thing I got told by the consultant at hospital was to build up the muscle around your knee. He says that would protect your knee. I have been going to the gym last few years, and most of that time I was cycling, I was on the cross trainer, and I always used to swim afterwards as well. So I'm out walking every single day. Once every couple of weeks I'm out over the Lake District doing a lot of fell walking as well. So again, combination of all them things really helped my knees, because they were building up the muscle around the knee. Unfortunately, with the lockdown, the swimming stopped, the gym stopped, the walking was cut down to a minimum, so the muscles start to go and the pain start to come back, particularly in my left knee. I tried the naproxen tablets. I was told you need to give it at least 2 weeks and hopefully that would settle it down. 2 weeks later, still the same. And to be quite honest, I felt as though the naproxen tablets weren't doing much good at all. So I've looked at other things I can do, and the first thing I come up with was these turmeric and black pepper tablets. Apparently turmeric is a really good anti-inflammatory, so it helps with the arthritis, helps calm that down if it's inflamed. The black pepper helps to absorb it more into your body. So to back up the turmeric tablets, I started using what I foolishly stopped using many years ago, was the glucosamine tablets with the added whatever that says. Now what they're supposed to do is, again, and apparently it's been scientifically proven with these, they build up the cartilage in between the bone. That stops the pain when your knees are grating together. And finally, I went back to an old faithful, cod liver oil tablets. So all three of them I've been using, I would say, for 5-6 weeks there now, and I have noticed a massive difference. I'm back walking there now 4 or 5 miles a day, and once I'm out walking and moving, my knees do feel okay. They don't feel right, but they do feel a heck of a lot better. Because about 5 weeks ago I was at the stage of I could only walk for about 15-20 minutes, and then I had to come in. I was in so much pain. Obviously, first protocol is always your doctor, because I've got no medical knowledge at all. So always first protocol, doctor. But basically all the doctor said to me was take the naproxen tablets. After 2 weeks, organise an x-ray. There was one option they did give us, and that was a cortisone injection into the knee. So if you've had one, I'd be very, very grateful in a comment if you could let me know how you found it, whether it did any good or not. But for years I played and I've done a lot of sport, especially when my two sons were little. After a full day's work, we'd go out, we'd be playing football, be playing squash. We did taekwondo for 5 years, and then middle age I started doing a lot of running, did the Great North Run numerous times. But all these things have come back to haunt us now, and all them things have a massive impact on your knees. So that's the stage I'm at the moment. Knees feeling slightly better, and every week it does get better, but very, very slightly. I have got one thing in my back pocket that I haven't tried yet, and I was recommended this by James over at Bad Hair Days, who recommended CBD oil. But apparently it's an extract of cannabis that is legal and can be taken in tablet form and can be used for like an arthritic knee. Not scientifically proven yet, but a lot of people swear by it, as did James. So again, if anybody's taken it and found it useful, I'll be very interested to hear about that. So I haven't gone down that route yet. It would be nice if you could sit down with the doctor and discuss all these things. The unfortunate thing is, when I mentioned to the doctor that I was taking turmeric tablets, the first doctor I spoke to said, great, I recommend to all my patients with joint problems, take turmeric. The second doctor, he'd never heard of this before. And that's the sort of concerning thing, where maybe one doctor tells you to do one thing and another doctor has never heard of this being used to treat an arthritic knee. One other thing I was doing, which I've stopped doing there now, I was very tempted just to rest my knee, to come in, sit down, put your leg up, but apparently that's the worst thing you can do. You've got to keep the joint moving, you've got to keep yourself moving, so plenty of walking. I've just bought myself an exercise bike, which I've got in the garage. So the exercise bike there, a few weights, my punch bag. So as well as keeping my legs fit, I try to keep my upper body fit as well. What I don't want is the bottom half of my body to get built up at the expense of the top half of my body. So try and keep the overall all-round fitness going until we can get out again properly and get back to the gym and get back swimming. One thing I was doing, I've stopped doing now, is basically that. Sitting down like that. This has been supported here, that's been supported there, but there's nothing to support this here. No matter how tempting it is to sit with your foot up there now, I've stopped doing that. So I feel as though I've done everything I possibly can do there now. Hopefully the improvements will continue, and hopefully if this lockdown eases enough, I'll be able to go to the doctors and discuss the benefits of a cortisone injection in my knee. If you can think of anything else, if you've tried anything else yourself, I'll be very interested to hear your comments. Again, I've got no medical knowledge at all. The stuff that I'm taking is word of mouth by friends, research on the internet, and the things that I have been taking, I feel as though it does a lot of good. I've also made sure that the things I am taking, made in the UK, no artificial ingredients, vegan and vegetarian friendly, manufactured in the UK to GMP standards. So I'm trying to buy the best ingredients. I'm also trying to buy a year's supply, which is a lot more cost effective than buying a month's supply or 3 months supply. So hopefully this quick video will be of interest to some people. And if it has, I mean, please let us know below in a comment. Again, if you can think of something else that I haven't tried, I'll be very, very grateful to hear it. Anyway, for all those who are suffering with a bad knee, best of luck.